Hello, everyone, and welcome to Get Ready for IAS 2023, a webinar on how to write a conference abstract organized by the Journal of the International AIDS Society, together with the International AIDS Society Educational Fund. My name is Alberto Rossi, and I'm the managing editor of the Journal of the International AIDS Society, and together with me is Anna.
Hi, everyone. My name is Anna Grimsrud, and I'm a senior technical advisor at IAS in the HIV Programs and Advocacy Department and a deputy editor of the Journal of the International AIDS Society. And we're really excited to see you all here today. Go for it, Alberto.
All right. So thanks, everyone, for participating. So during the webinar, we'll give you an overview on how to write a good abstract for a conference and what are the most important parts of it. There will be a Q&A session at the end, so we ask you to post any question that you have during the webinar in the Q&A functionality in Zoom, and we'll try to respond to as many as possible at the end of the session. And we're also going to have a survey at the end of this, which we very much kindly invite you to take. This will help us to improve on our future workshops. So, let me see if I can move this. There you go. So thanks again to our colleagues from the Society and the Educational Fund team for supporting the preparation and organization of this webinar. So before we start, I'm going to give a brief overview about the Journal of the International AIDS Society. Our aim is to provide a platform for dissemination of HIV research, and we encourage submission from low and middle income countries. We are an online-only journal. We are peer-reviewed, and we are open access, which means everyone can see, read, and download our articles. Our new impact factor is 6.7, which raised significantly from last year. We are indexed in the major repositories and libraries. We are multidisciplinary, meaning that we cover all the aspects of HIV research, from basic science to clinical science, epidemiology, policy, health economics, behavioral science, and so on. And the journal is also very much interested in providing capacity building opportunities to less experienced authors, such as the webinar that we're doing today, to increase their participation in the scientific community. So here's the agenda. We're going to give a brief overview of the abstract structure, and then we're going to get into the details of each of the sections of the abstract. And then we're going to speak a little bit about the language that we encourage to use in writing scientific abstracts. And then we'll give an overview about the submission and selection process for the IAS 2023 conference. And as I said before, we're going to have the Q&A session at the end. So how to write a conference abstract? Well, the key to writing a good manuscript is to tell a story. And we love this quote because it really summarizes the concept of this webinar. The idea is that we'll give you the elements to tell the story. If you follow the suggestions that we're going to provide in the next few slides, at the end, you should really be able not just to put together a few sentences, but to tell a story. So what is an abstract? A conference abstract includes all the important details and data from your research so that it can serve as a standalone summary of your work. It's really key to highlight the standalone summary concept, because really your abstract is an independent piece. Of course, it goes together with your full submission, or it goes together with an oral presentation, but it really should be independent from that. The reader should be able to understand what you did just by reading the abstract. And the abstract is structured in 5 different elements: the title, which is the headline of your study. And then the introduction, which describes the issues, the reason why you're doing this, and the knowledge gap and the aim of your study, the methods, which is the methodology that you applied, the results, which are the finding and data from your study, and the conclusion, which summarizes the outcomes and the implications. So in the next few slides, we're going to go through each of these sections more specifically to give you some suggestions on how to cover each one of them. Before we do so, we have a question for you. So we're going to use the PAL functionality. So the question now is, what is the most important part of a conference abstract? A, the title, the introduction, the methods, the results, or the conclusion. So let me see if we can launch the poll. Okay, we're going to give you a minute to think about this. and then we'll discuss together the results. Okay, see that 50% of you responded, so we'll give you another 15, 20 seconds. The responses are anonymous, so don't worry, don't be shy. Okay. 10 seconds. All right, I'm gonna end the poll now, and we're gonna see the results. So you can see that 37% of you responded the title as the most important part of the abstract. And then there was a almost even distribution across the other 4 sections. Okay, you should now be able to see the results. Sorry. Okay, here is what we think is the most important part of the abstract, the title. So 37% of you got it right. Why is the title the most important part of the abstract? Well, because the title is the part most often read, often is the only part read. So you want your title really to catch the attention of the reader. If the reader is not interested in your title, they will not read the abstract. So that's why we think the title is the most important part. The title should summarize your work in about 30 words. This depends on the guidelines of the conference or the journal you are submitting to. And most importantly, the abstract should cover the what, the where, the how, and the who is part of your study. Titles will be short, specific, representative, and informative. And again, it should be a mini advertisement of your research, of your abstract. Again, think about someone reading the title. If they're not cut by that title, they will not read the abstract. And in the title, there's not specific instruction about sharing results or recommendation. You can if you want to, but think about the length of the title. It's not very easy to put together all those elements, that what, where, who, and how, and the recommendation. So we would suggest that those are not included in the title. And we're going to have now another, next slide. Okay. So this is a title that we took from a publication in the Journal of the International AIDS Society, and we modified it. And we're going to ask you a question. So what different types of information does this title contain? Is this or not a good title? I'm going to read it. Facility-based HIV self-testing strategies may substantially and cost-effectively increase the number of men and youth tested for HIV. Results from an individual-based mathematical model. We're going to ask you what kind of information is missing from this title? What, where, who, and how? Okay, we'll launch the poll, so you should now be able to see. And we'll give you 30 seconds to think about this. I can see more consensus about this already. Okay, 10 seconds. 5. Okay, I'm going to end the poll and show the results. Okay, so 64% of you indicated that is missing the word. So let's dissect the title and see. Okay, let's see. So we have facility-based HIV self-testing strategies. That's the what. And then we have who, men and youth, and then how, individual-based mathematical modeling. And indeed, 64% of you guessed it right. We are missing the where element, which is, let me stop sharing this. And you can now see the original title, which also included the where in Malawi. So this is a title that we think covers the 4 elements we discussed before: what, who, where, and how. So if you read this title, you will basically almost understand everything about what this study is covering. Okay. And now we are into the introduction section, and I will give the microphone back to you, Anna.
Great. So we are having some interesting challenges here where we can't work out how to let you all type in the chat, but please feel free to ask questions in the Q&A and we'll answer them as quickly as we can. And there's also going to be an opportunity for questions and answers at the end of the webinar, but we're probably just going to take questions that are in that Q&A. So for those of you who have raised hands, please consider typing your question in the Q&A. Also going to ask Alberto to make me a co-host so I can see the results of the poll in real time. And if any of you happen to have signed in twice, please consider shutting down one of your devices because we are actually at capacity and we want to make sure as many people as possible are able to join us today. So I'm going to walk you through the intro and methods before handing back to Alberto. And so if you go to the next slide here, you'll see that an introduction section is really supposed to introduce the reader to the topic. However, you really want to remember that in an abstract, you're going to have not a lot of words to work with. And so whenever possible, you want to save some words to really focus on using them in your methods and your results. And so the objective in the introduction section is to cover 3 things. You want to cover the topic, you want to cover the issue, and you want to cover the aim. And just like we saw for that last title, we're going to use some examples from real articles that have been published in our journal, where we edit them a little bit to give you examples of how to show this. So your topic might be on differentiated service delivery in West and Central Africa. The issue may be around low uptake of PrEP in specific populations. And then finally, you always want to end with your aim. So for example, here we have the proportion of pregnant and breastfeeding women receiving routine HIV care in maternal and child health clinics in Kinshasa. So let's look at an example introduction section now. And an introduction section in an abstract, if you go to the next slide, is really going to be 2 or 3 sentences. So very rarely more than that. So again, here, we're looking at the paper by Nichols that was published just last month, and they've written, as we approach epidemic control, interventions to improve coverage will become more costly. There is, therefore, an urgent need to identify innovative and low-cost strategies to maintain and increase testing coverage without diverting resources from other HIV services. So we can launch that 3rd poll. And here the question is, what is missing from this introduction? And I've edited it, so this isn't actually exactly as it appears in the journal. So are they telling you what the topic is? Are they telling you what the issue is? And are they telling you what the aim is or what their study intends to do? And I'm going to give you a few seconds there to make sure that I hear from as many of you as possible. So again, do they cover the topic, the issue, and the aim? All right, Alberto, you can go ahead and end the poll for me. And you'll see that 41% of you thought it was the topic, 12% the issue, and 46% the aim. And if you go to the next slide, you'll see that it was the aim that I cut out. So here in red is the issue, in purple is the topic. And if you hit the next slide, what the study did was model different combinations of facility-based HIV testing modalities to determine the most cost-effective strategy to increase the proportion of men and youth testing for HIV. And this is really, really important. You would never want to leave out the aim of your study. And as a reviewer and as a reader, I'm always going to look to the end of the introduction to make sure that the aim is this last sentence. So I just want to make sure and emphasize how important it is that you do include your hypothesis or the purpose or the aim of your study as the last sentence. And thanks for the feedback in the Q&A. I will try and speak a bit more slowly. All right, moving on, next is to the methods section. And if you hit the next slide, your methods is like your recipe, okay? And what is amazing about the science field that we all work in is that we really actually want to share our recipes. We want to make it as easy as possible for people to repeat the same thing that we did in another setting or another time or with another population. And so what your methods section really needs to do is answer the W questions. All right. So you want to talk about who was in your study, what you measured on them, how you did this, where it took place, and when it took place. So all of these components or all of these questions should be articulated in the methods section. In an abstract, you may not be able to go into a huge amount of detail, but you are going to want to make sure that each of these parts is in there. Another important part of a method section is both your method section, and you'll see this later on, but your results section need to be written in the past tense because your study has already taken place. And so it's important that you don't say, for example, we are measuring, you'll say we measured or we analyzed or we recruited people in this way. So make sure that you answer your 5 W questions in the past tense. Moving on to our example on the next slide, you can see here that we're looking at a new abstract now, also published last month. So in this study, and I'm just going to read this out to all of you, gay, bisexual, and other men who have sex with men were recruited through respondent-driven sampling in Toronto, Vancouver, and Montreal, Canada. We examined temporal trends of PrEP use and correlates of PrEP awareness and use from 2017 to 2020 among self-reported HIV or people who don't know their status of gay men and other gay, bisexual, and other men who have sex with men. So looking at this method section, you can launch the poll now, please. Is the who included in here? Can you see the how or what they did? Can you tell where the study took place? Can you tell what was looked at? And can you tell when it took place? So all of these details need to be in the methods section. And hopefully you'll remember that I said you want to save and limit how much words you spend in your introduction so that you can be clear in your methods and clear in your results, because those are going to be the most interesting parts of your study. So I'll give it a few more minutes here. Yes, we can for sure share the references. I'm finding out about the slides now, everyone. Thanks so much. All right, we can end the poll and we can advance the slides. So roughly half of you thought the how was missing. And again, about a third of you thought what was missing. So if we look here, we know that where is in Canada's 3 major cities, Toronto, Vancouver, and Canada. The who is very clearly articulated. It's gay men and other men who have sex with men. The when, we've got a time stamp there. And the what, they were looking at temporal trends of PrEP use and correlates of PrEP behavior. But if you hit next slide, what we'd edited out of this abstract was that this was a prospective behavioral cohort study. So that's the study design. So that's part of the how. And that they applied generalized estimating equations with hierarchical data RDS chain participant visit. So that's the what, or not the what, sorry, that's the how they did the analysis and what they did in terms of analyzing the data. So make sure that you save some of your words because you're going to need them to answer all 5 of those questions. Back over to you, Alberto.
Thanks, Anna. So we've seen the title, the introduction, the methods. It's now time to look at the results section. So what findings did your question generate? So in your results section, you want to put the results but only those that were generated to respond to your question. It's an abstract, so you can't put everything. So stick to your question and only respond to that question. In the full submission, you might be able to expand, but in the abstract, only the data that would respond to your question. Statistical analysis that represent the significance. So we are scientists, and if you add a statement, you need to support that with your statistical analysis. So make sure that you know how to use significant, and don't use vague terms such as some, many, few, a lot, a bit. Those are not for scientific writing. A visual representation of your data using figures, tables, or graph whenever possible. So if you have some numbers to present, consider, instead of writing them in a text, to use a table or a graph. Don't do that twice. Don't put the numbers in the text and in the table, or in a table, or in the graph. Choose one, the one that you think is best to represent the results, but only one. Don't duplicate it. It's just wasting space. Do not discuss the results. Do not repeat again the methods, and avoid speculation. And as Anna mentioned, for the methods, this is something that you did in the past. So use the past tense. So we found that, not we find that, we found. Okay. So here we have again a modified result section from the abstract that we published a few weeks ago. So I'm going to read it to you, and then we're going to again have a poll and dissect this text and see where we think it can be changed. So of the many self-identified HIV negative unknown GBM at baseline, over 5,000 study visits were completed from 2017 to 2020. At baseline, overall PrEP awareness was good, and overall PrEP use was quite low. During our study period, we found PrEP use increased in all cities. Montreal was the lowest during the first time period to the most during the last time period. Toronto also improved, and Vancouver went up to nearly 60%. Across the study period, more Vancouver GBM used PrEP than Montreal GBM, with no difference between Toronto and Montreal GBM. Okay, so I'm going to launch the poll question. And we're going to ask you to say if the results are being discussed, if the data is not being specific enough, or if this result section is perfect. I'll give you 20, 30 seconds to think about this. Okay, we got 50% responses. Another 10 seconds. All right, I'm going to end the poll in 5, 4, 3, 2, 1. Okay. Okay, so 31% of you indicated that the results are being discussed. 51% indicated that the data is not specific enough. And 18% indicated that this is perfect. So what you can see in this next slide is the actual original abstract. And you can see that there are many, many changes that we intentionally introduced for the purpose of this webinar. Again, remember, this is scientific writing, and scientific writing implies that you are specific. So let's see what the original abstract is like. We said of the many self-identified HIV negative unknown GBM, that's wrong. If you have a number, you use the number. So you say of the 2008 self-identified HIV negative unknown GBM. And then we said over 5,000. No, you have a number, so use that number, 5,093 study visits. And then the time frame, if you have a more specific date, use it, February 2017 to March 2020. And then at baseline, overall PrEP awareness was good. Good doesn't really mean anything. It could be many things. So you want to use the exact number that you have, 88%. And low also doesn't mean anything. So don't use low, use the specific number that you have. During our study period, we found PrEP use increase in all cities. Okay, but you need to show that is statistically significant. So if you have a p-value, use a p-value. In this case, it's p less than 0.001. And so I'm not going to go through all of these examples, but you can see that scientific writing needs to be specific. Your abstract, therefore, needs to be equally specific. Okay, on to the next slide.
And this is me, I think, when Alberta gets there. I want to just interrupt for a second and make sure that you're all aware that we will share the slides after the session today. They will be emailed to you in the coming days for everyone that is registered. And thanks for the great questions so far in the Q&A. Some of them we will get to and we will answer live at the end of the session. So another important thing that we want to stress is that of data disaggregation by sex or gender. And what we want to do is encourage that when you present your results, you do this disaggregation. So many research studies include multiple genders. And so we want to make sure that where possible, that data is collected so that you can share and see if there were any differences in who was recruited, who was retained, who participated, what their outcomes were. And there's some really good guidance that has been developed by the Canadian Institutes of Health Research on this. And then there are also these SAGER guidelines, the Sex and Gender Equity in Research. And both for the Journal of the International AIDS Society, the conferences that we convene, as well as in general, it is a standard best practice that you report on sex or gender within your analysis. And so we would encourage you to do that. Next slide. The other thing that is important in terms of telling your story is that you might want to consider what we call inserts or tables and figures. And tables and figures are a way to visually represent usually your data. So you can use a table or figure in your methods, but most commonly they're used in your results section as a way to better communicate your story. So you'll know the adage that a picture is worth 1,000 words. And sometimes it's much more effective to communicate what you found in a table or a figure. And it can also be a much more efficient way in terms of space to share a lot of your findings with your audience and with your reader. In most cases, so I actually don't know of a single case, but journals don't allow tables and figures in your abstracts, but many conferences and many events do. So you want to check to see if that is the case and to see if a table or a figure counts towards your word limit. And then you want to make sure that by doing so, by adding a table or figure, it's adding something. So don't do it just because you can, do it because you think it's a better way or shares more information. You also want to make sure that it's easily readable and interpretable. And you also want to make sure that it's cited or referenced within your text. So you shouldn't have some random table or figure that isn't quoted in the text. But further, you don't want to quote everything that's in your table and figure, otherwise that's just redundant. So you need to find that balance. Here you'll see an example on the next slide of when they have taken some data. Oh, not yet, sorry. You'll see in the bottom left-hand corner here, a little IAS 2023 logo. And I'm going to talk you through some more details about this upcoming conference. But just wanted to flag that for IAS 2023, you can include up to 2 tables or graphs in your abstract submission. Each of these counts as 50 words. So we'll get there to the point, we'll get to the details of what an IAS 2023 abstract looks like in terms of our rules and our guidelines. But just know that they're going to count as words. So you don't get them for free. You don't get the full word count plus a table or figure, but you can include 2 inserts if you would like. Next slide. So this is an example of when they have taken data and put it into a table. And you can see here the question, apologies, I'm going to sneeze. Can the data be more clearly and concisely presented in a graph or table? And here it's not really helping or adding anything by having this information in a table. So again, I don't think this is the most effective use of space or really helping your reader in terms of their knowledge and it making it more efficient for them to read. If you hit the next slide, you'll see data that's presented first of all as a table and then secondly by a figure. And if we launch the poll here, we're going to ask you, do you guys like the table more in terms of seeing what the breakdown was of the type of occupations that people have? Or do you like the graph more? And it's great that many of you are answering this question. And I think what's important to remember is that you can always make improvements with your tables or figures. Here, we didn't have a lot of options in terms of colors. And so you actually would want to spend more time on the colors if you were going to have a figure so that people that maybe print off the findings and see it in black and white, or people who are colorblind can still read your figure clearly. And I'll end the poll here and show the results. And poll, share results. And you'll see, yes, the majority of you, 71%, liked the graph more, but this is a little bit subjective, right? So make sure you share your tables and your figures with your colleagues to see if they think they're a good fit. And there you go. So in this case, the graph was a more clear representation of the data, and it probably saved you a lot of words. So you can imagine how long the sentence would be to give all of this data to your reader. Next slide. So I'm going to head back to Alberto for the conclusions, and I'll see you all to talk about IAS 2023. Sorry, Alberto, we can't hear you. There you go.
I was muted. Sorry about that. So I was saying that we have now reached the end of the abstract with the conclusions. So the conclusions must reflect the data as presented in the abstract. Do you not include in the abstract things that were not presented, because otherwise, in the conclusion, because otherwise, the reader will question where that conclusion comes from. It needs to be supported by the data presented in the abstract. It needs to provide a take-home message and the wider implication of your findings with some recommendation for future research, ideally. Avoid of the statement, avoid repetition of the results, and avoid overgeneralization. Remember, the abstract is short, so don't duplicate the number of times that you put the same information. It's useless. And about the generalization, I think it's very important because we all like to provide a final recommendation, but you need to make sure that you stick to what the result of your study provide. If you've done a study in a specific population or a specific environment or country, don't say that the results will apply to the entire world or the entire population, because the reader will really question that statement. So we now have a conclusion. And I'm going to ask you whether this is a good conclusion section or not. So I'm going to read it for you. Peer community health workers were highly effective at reaching key population communities, identifying persons living with HIV and linking them to care. Engaging key population community gatekeepers resulted in high diffusion of health messages and increased access to health resources. The mobility of community health workers and healthcare workers is a challenge for program implementation. Innovative interventions are needed to support people who inject drugs and people in prisons and enclosed settings. So I'm going to launch the poll now and ask you whether you think this conclusion section represents, covers the aspects that we discussed. Okay, give it another 15 seconds. All right, 5. Okay, ending the poll now, and we'll show the results. So 57% of you indicated that this is a good conclusion section, whereas 43% were not so convinced. So we're gonna, again, look at what this conclusion includes, and we will see that we think this is a good conclusion because it covers the three main aspects that we think should be in a conclusion. So the take-home message is peer community health workers were highly effective in reaching key population communities, identifying persons living with HIV and linking them to care. What does this imply? That engaging key population community gatekeepers resulted in high diffusion of health messages and increased access to health resources. However, the mobility of community health workers and healthcare workers is a challenge for program implementation. Therefore, and here we go into the future recommendation, innovative interventions are needed to support people in drug drugs and people in prisons and enclosed settings. So we believe this well summarizes the abstract. And then in the next slide, we will recap the elements that we discussed. So the introduction, so that will introduce the topic, the issue, so the why you're doing the study, and the aim, again, why you're doing it and what you're aiming to. The methods, we will cover the who, how, where, what, and when of your study, and the results that need to be specific to your objective of the research. And then last, the conclusion, which is the take-home message with some future recommendations specifically based on your results. What we will see now is the language. I stressed before how important it is to include data in your scientific writing, but the language that you use is equally important because it will give the reader the idea that your abstract is well argumented and well presented. So we love this quote, which I'm going to read. It's taken from the UNAIDS Terminology Guidelines. These are freely accessible on the web. We'll share the links in the email that we'll send about this workshop. So the quote is, language shapes beliefs and may influence behaviors. Considered use of appropriate language has the power to strengthen the global response to the AIDS pandemic. So we really invite you to not use HIV infected or carriers or victim or patient. This is language that doesn't help us moving forward in the HIV epidemic control. So here are some more specific examples that you can, of course, copy from. The most common one that we see as a journal is the use of infected, HIV infected. We encourage you to change that and use people living with or affected by HIV. Again, you can see this. We'll share the slides. So you have this table that we really encourage you to stick to as much as possible. The next advice is on language style. Of course, many of us are not first language speakers, so it's a bit more difficult, but here are some tips that we want to give you so that you can improve on your scientific writing skills. First, use active voice. So we have an example here. A paper on DTG and weight gain was published in 2020 by Dr. Smith. We do not suggest you write like this, but instead use Dr. Smith published a paper on DTG and weight gain in 2020. And the second one is, do not begin a sentence with the word it. It was decided that the experiment should be conducted on a random sample. We rather suggest you to say the experiment was conducted on a random sample. And the last is, do not use nouns when you can use the verb of the word. So don't say we gave much consideration to, simply say we considered. Don't say he provided an explanation about, simply say he explained that. You can see that the common theme across this is that what we suggest is always shorter than what we don't suggest. And that will be helpful for you because it's straightforward, it's clear, and it gives you more space to use other words for what you need to discuss in your abstract. And here are some good practice and common mistakes that, again, we see in the abstract submitted or in the, also in submissions to the journal. So good practice is watch the word count. An abstract or a paper that goes over the word count is not a good sign. It means that the author haven't really read or paid attention to the guidelines, which is a flag for the editors. Keep your audience and reviewers in mind. So for example, the Journal of the International AIDS Society is an international journal. So it's important that we keep that in mind. The context has always to be applicable to a broader audience. Be clear and concise, only include essential information. Check spelling and grammar, ask a colleague for feedback. All the software that we use have a spell check tool. Please use that, because if you submit an abstract with typos, that's not a good sign. The reviewers and the editors are not going to like it. And comply with submission guidelines. Unfortunately, the guidelines change conference to conference, journal to journal, so we understand that it takes time to follow those, but it's really important that the authors do. Then here are some common mistakes that we see. Reasons and aims of the study not clear. This is something that Anna stressed already before. We do want to see why you're doing this study, because otherwise, the reader might not appreciate the impact of your study. The methods are incomplete, and if these are incomplete, the reader cannot replicate your study or can question how you achieved those conclusions. The most important results are not concisely presented. Again, the abstract is short, so you need to make sure that the most important results are introduced, are presented in your abstract. Don't put the accessory results, put the main results in the abstract, and then use everything else in the full article. Conclusions are overgeneralized. This is something I touched on already before. If you did a study on a particular population or in a particular country or with a particular drug, don't assume that you can apply that to every other context. And implications are not highlighted. Again, the reader will want to understand what this means, and now what, and now what's next. What is your study? What the advance is that this study brings. Okay, and next I will send it back to Anna.
Great, thanks everyone. I'm sorry, I'm frantically typing here so we can have more time for some of the questions later on. So I know that many of you have joined to kind of get some insight on what we're going to be looking for the IAS 2023 conference. And I'm going to share with you some kind of top tips and some behind the scenes pieces to hopefully help you improve your submissions. If you go to the next slide. So the IAS 2023 conference, as many of you have heard, will be in Brisbane, Australia, and virtually. It will be a fully hybrid conference taking place next July. And the registration and abstract submissions open in 1 week's time on the 15th of November. And all of these details will be available online on the conference website, which is ias2023.org. Next slide. At the Brisbane conference, we will have 5 conference tracks, and abstracts across these 5 tracks can be submitted from the 15th of November through to the 31st of January. We will also have late breakers. Those will open on the 20th of April and close on the 10th of May. It's really important just to note that late breaker abstracts are only for science that has been finalized since the deadline of the abstracts. So you need to make an argument for why your science is a late breaker, not that you only just finished it now. It needs to be because the data is very recent. So the majority of science published at a conference is through the normal abstract submission system from the 15th of November to the 31st of January. Next slide. You have 2 options, and some of you asked questions about this in terms of framing, and every conference is different and every journal is different. So you can either submit with option 1 or option 2. Today, Alberto and I have been talking about option 1, which is the more generic scientific structure, which is background, methods, results, and conclusions. And this applies both to clinical science, basic science, epidemiology, qualitative, quantitative, health systems research. The full gamut can be written up in this way. Option 2 may be for lessons that are related to a program or a project or a policy implementation or management. So here you would have something quite similar, but you'd have a background to why this work was done, a description of it, the lessons learned, and the conclusions or next steps. But the majority of abstracts submitted will be under option 1. Next slide, please. When you submit an abstract for AIDS 2023, you need to have an online profile so you need to have a conference account. So we encourage you all to update your IAS accounts, particularly from the 15th of November. And you want to make sure that you obviously have approval from all of your co-authors and anyone else you need to before submission. And when you submit, you're also going to choose a track and you're going to choose a subcategory. And as I mentioned for IAS 2023, you'll have the option of 5 tracks and a number of subcategories. Next slide. So this year for the IAS conference, we will have basic science, clinical science, epidemiology and prevention science. And then we've expanded and split out track D into being 2 specific tracks. So we'll have 1 track on social and behavioral sciences and 1 track on implementation science, economics, systems, and synergies. So it's important that you acknowledge and you determine which track your science fits best into. Next slide. In terms of how they're selected, so this can sometimes feel very vague to you as the writer, where you just put your work out there and you see what happens. But I want you to know that when you submit an abstract, it is reviewed by at least 3 external blinded peer reviewers. And then those scores are sent to the track committee. And the track committee is comprised of researchers and academics working in that track and in that field. And that track committee determines which of the abstracts will be oral abstracts, which will be oral posters, and which will be posters. And so this is a really important process for us. It's not IAS staff, it's not IAS friends, it's scientists in your communities who determine and rate the science and then select what abstract will be presented in what format. Next slide. I want to share with you some data, but before we do that, this is to give you an overview of the peer reviewer criteria. So this is what the peer reviewers are asked to assess the abstract against as a part of this. So I won't go through this in detail, but this will also be available on the conference website and is important for you as a writer to consider, again, because this is how your abstract will be scored. Next slide. So just to give you some background, so the last IAS conference was in 2021. This was a fully virtual conference. There were 1,800 abstracts submitted, and you can see that we have a lot of science in track D submitted, and that's why we split that track. And across the track in the purple dots, that's the acceptance rate. And what's important is that if you drew a line kind of through the middle there, you'd see that overall about 45% of abstracts submitted were accepted. And of those, 16% of what was accepted was an abstract, an oral abstract, and the other 84% were e-posters. Okay, so there's a very small proportion of the science that is an oral presentation. To the question that just came up in the chat, it's an oral presentation if the track selects it as being one of the top, most interesting, most scientifically sound abstracts. And so the highest scoring abstracts will be most likely to be chosen by the track committees to be an oral abstract. Next slide. To give you an idea, for those of you who were part of AIDS 2022, here we saw 6,900 abstracts across the tracks. And again, in red are those not accepted, and in teal are those accepted. And we had an acceptance rate of 37%, okay? So even lower than IAS 2021. And again, 40% of regular abstracts and 16% of late breakers, with only 6% being orals, 12% being posters, and 82% being e-posters. So just know that we accept a lot more posters than oral abstracts and don't get deterred. you who are interested to also apply for a scholarship, and the scholarship applications will also open later this month. And what's really important is that when you apply for a scholarship, you cite your abstract number, because we do make a big effort to ensure that the top science from the conference, that those people are supported to attend virtually or in person. So consider if you want to think about applying for a scholarship, and also start getting ready for that, which will also open on the 15th of November and end on the 31st of January. And so I think that's it. If you go to the next slide, we're going to take some questions from the chat now, before we ask you to complete a survey. I want to just flag some of the things that I've tagged to answer live. So qualitative results to the question 20-30 minutes ago can definitely be presented in the same format of introduction, methods, results, discussion. So that shouldn't matter. In terms of the statistical approach, you do need to include something on your analysis within the methods, because what you did is part of the methods and your findings are part of the results. And then to an anonymous person, we do not verify the truthfulness of abstracts that are submitted or are shortlisted or accepted. However, we have very strict rules around what we consider. And so we would recommend that you read in detail all of those pieces once they come out. And we obviously do take fraud very seriously and have had examples of cases where people have contacted us about non-truthful data. Alberto, do you want to take some of these questions?
I was just going to add that we also check for plagiarism related to this. So every abstract is screened for plagiarism. Yeah, I had some questions that I wanted to ask for. Let me find it. There was a question about whether the abstract should include the ethical board approval, and we don't think that's necessary. I mean, again, you have limited space. Usually we don't see that in the abstract.
Yeah, so some of the detail that you guys called out in general is really useful for the full manuscript, but you'll be constrained by the word count within the abstract. So one of the questions here was what section should contain more words. And for me, the introduction and the conclusion are really quite small, whereas the methods and the results are where you want to spend the bulk of your time. So that's kind of my guidance to all of you. There aren't key words with an abstract either, so that's another question answered. Go ahead, Alberto.
There was one about incomplete studies, if they can be made into an abstract. That's a very good question. It depends on how incomplete they are. If you have no idea what your results will be, obviously that would not be a standalone, independent, scientific piece. Because if you cannot provide any result, that doesn't meet the requirement for the abstract. If you have some preliminary result that you hope to be able to support with more data, then of course we would encourage you to consider writing an abstract.
Yeah. The same would be that we don't at the conference publish study designs. We don't in the journal either. But we do publish reviews. So you can submit a review to the conference or to the journal. And in terms of references, there are not typically references within an abstract. And so that's why you don't necessarily present a really specific figure within the introduction of an abstract. You more state the scale of the challenge as opposed to the specific reference.
There was one about writing an abstract of a project that hasn't started yet. Again, good question, but it depends how far you are with your study. If you haven't started yet, it's likely that you don't have any result to include. So maybe it's best to wait for the following conference.
And then there's a great question here about us talking about research versus programmatic work. And I think that programmatic work can often be science as well. It can often be research as well. So you have the option to present it within the same format of introduction, methods, results, conclusion, or you may feel that your programmatic work is better presented as option 2, where you share a description of what was done and the challenge that it was in response to, and then some lessons learned. So if you don't have final results yet, I think Alberto's answered that. I just want to state that abstracts aren't limited to any country. And I would refer, it's great to hear some of you talking about language, the words clients versus patients versus recipients of care. I think that's really important. What we want to encourage is this person first language, and we take our guidance from people living with HIV and from people affected by the HIV epidemic, as well as from global normative agencies like UNAIDS and WHO. So whenever possible, we want you to look at what that current best practice is. WHO uses patients and clients, and I acknowledge that recipients of care is becoming more mainstream used as well. Just be sure that if you're using a term like recipients of care, care could mean many things. So that doesn't necessarily mean they're people living with HIV. They could be people vulnerable to HIV. We only have a minute left. You can use last year's conference account. You just want to check that your details are up to date, but I'm going to turn back to Alberto to close us off. And
I'm just going to re-answer a question that you already answered about the keywords. You're right, there are no keywords for the abstract, but that's made me think that when you write your title, think about something that can be easily searchable, because people will try to identify or try to find information using keywords. And if you make sure that your title has some of those specific words that are more easily searchable, that would help the visibility of your abstract. So not necessarily put keywords in terms of using keywords as you do for the full submission, but make sure that your title has some of those interesting words that people search for. And yeah, with this, we'll close the workshop. Again, we are going to share in the next few days this presentation. And we kindly ask you to fill the survey that you will receive. We want to thank you, our colleagues in the Educational Fund Department for their support, and the Swiss Agency for Development and Cooperation for supporting us. Please, please, please do fill the survey. Be honest, it's all anonymous, so you can say whatever you think, but we really appreciate your feedback. It will help us to do a better job.